Hi, my name is Ricky Shepard. I'm the respiratory therapist here at Community Hospital South. Today we are going to talk about trach care and suctioning your tracheostomy patient according to the current Community Hospital Network policy and procedure. The first thing you'll want to do is to gather all the necessary supplies that you'll need for both trach care and for suctioning your tracheostomy patient. You'll want a bottle of normal saline unopened. This is good for one-time use only and will be disposed of after the trach care, even if there's some left in the bottle. You also want to get a trach care kit, an appropriate size suction catheter, and the way to figure out what size suction catheter your patient will need is to make note of the trach tube size found on the tracheostomy tube and to multiply that by 2. For example, this is a size 6 Shiley, so multiplying that by 2 indicates that we'll need a size 12 French suction catheter for this patient. You also need to assess whether your patient's trach ties need to be changed. So you'll want to have extra set of trach ties at the bedside as well. You'll need a second healthcare provider in the room with you if these need to be changed. The indications for changing trach ties would be if they appear to be soiled, wet, or have excessive secretions on them. The next thing you'll need to do is determine whether your patient has a disposable or a non-disposable inner cannula. The Shiley brand trach tubes come in both a disposable and a non-disposable style. The disposables have clips on either side. Those clips you will pinch, pull out that inner cannula, and throw it away. You'll replace it with another disposable inner cannula of the same size of your trach. The non-disposable style of inner cannula, twist, pull out. These are the ones that you will clean using your trach care kit and replace. At any time before, during, or after trach care, your patient may need to be suctioned. You'll want to make sure your suction is turned on and ready to go. You'll do this by turning your regulator on to the regulation side for continuous suctioning, occluding your suction tube, and ensuring that your suction level goes up to at least 120 millimeters of mercury for adequate suction power. Finally, you'll want to have a manual resuscitator turned on to 15 liters a minute, laying at the bedside ready to go. This is in case the patient decompensates or needs to be pre-oxygenated before or after the treatment. Now we are finally ready to begin our actual trach care. Mr. Jones, hi, my name is Ricky. I'm with Respiratory. I'm going to start your trach care soon. It might make you cough a little bit, but I'm going to keep you as comfortable as possible. Do you have any questions for me? Depending on what type and size of trach tube your patient is in, they may or may not be able to talk. Be sure to assess that and provide alternative means of communication for your patient. Now I'm going to go wash my hands. With my non-sterile gloves, I can now pull his old trach dressing off, gently pulling from the bottom and making sure that it's not getting caught on any part of the trach tie. At this point, you want to take note of the color and drainage and the amount of drainage that's on the trach pad. And now I'll unhook his trach mask from his trach, but leave it in place so that he can still breathe in oxygen throughout the procedure. Now we're done with our clean part of our procedure, and we'll begin the sterile portion. First, I will begin by opening up all my supplies before putting on my sterile gloves. Next, we're going to open up our trach kit. We're going to open it up, place everything on the sterile field, and lay all of our contents on there. This is also a good time to go ahead and set up for possible suctioning for your patient. opening your suction package and making sure your suction is set up and ready to go as we did at the beginning. You can now fill both of your bins in your Trach Care kit with your saline. Now I'm going to put on my sterile gloves. I've determined at this point my right hand is the hand that will stay clean and sterile, while my left hand does more of the dirty work. I'm removing the patient's oxygen just away from him to give us room to work. With my dirty hand, I'm going to remove the inner cannula. You do this by twisting and then pulling out, and place this in my bin of saline to soak. This will help loosen up any dried secretions that are on the inner cannula. Next, with my clean hand, I'll remove the gauze, dip it into the other bin of normal saline, and at this point I'm going to cleanse around his stoma site. At this point, it's a good time to take note of the stoma site to see if there's excessive drainage, secretion, or redness. If necessary, you might need to get a wound consult if the stoma site looks infected. The last step is we're ready to replace and clean our inner cannula. With the brush provided in the Trach Care kit, you can push the brush into the inner cannula to clean and loosen once again any dried secretions. Now we're ready to replace our inner cannula. It's okay if there's some saline on there. This will aid in sliding your inner cannula back into the patient. During this process, the patient may begin to cough, and that is normal. Slide your inner cannula in and then turn it to lock it into place. In your Trach Care kit, you also have a sterile dressing. This is to replace the soiled one that we removed. Gently feed the new dressing under the trach ties and around the trach tube plate. And replace your patient's oxygen device. Now you're completed with your Trach Care. Now would be a good time to reassess your patient, check their oxygenation, determine whether or not the trach tube is stable and secure. Also determine whether or not your patient needs suction at this time. If trach ties change are needed, you'll need 2 healthcare providers in the room, one to help keep the trach secure while the other one changes the trach tube ties. Once the trach tube ties are on, you'll want to stick one finger beneath the trach ties to make sure that it's snug but not too tight. Mr. Jones, I'm all done with your Trach Care now. Is there anything else I can do for you? At this point, your patient may need to be suctioned again. They may have needed to be suctioned before or after the Trach Care, or during as well. Like we stated at the beginning, make sure that your suction is turned on and ready to go, as well as a manual resuscitator turned on and ready to use if needed. You'll need to pre-oxygenate your patient before you suction them. You can do this by either using the manual resuscitator and assisting the patient with some breaths, or replacing their oxygen and having the patient take deep breaths through their oxygen. We have our sterile suction kit open and ready to use. With the suction kit, it's included a basin so that you can pour normal saline in that basin. This is to be used to clean your suction catheter in between passes. Once again, I've already washed my hands and I have sterile gloves on. My left hand will be my dirty hand in this procedure, and my right hand will be the clean hand. You want to remove your suction catheter, and with your dirty hand, grab your suction tubing, placing it on the end. We'll insert the suction catheter gently but quickly through the trach tube. You'll gently go down until you meet resistance and back off. At that point, you'll want to depress your suction catheter and pull out. That whole process should only take 15 seconds. At this point, you'll replace your patient's oxygen, let them recover, clean out your suction catheter, and assess whether or not you need to suction again.